Dr. Bar, are you there?
Yes, I am.
Hi, how are you? Good morning.
Good morning. Hi,
So
Rob.
I was saying that we've known each other for a while, and you are out there doing something that I think is very important right now, because it's the not knowing that's driving people nuts, and not knowing whether they're safe, they're not, they're a danger to others, they're not. It's all this unknowing that's really kind of making this even more difficult than it already is, with the sequestering and the staying at home, etc. So without further ado, if you wouldn't take a minute and tell people what you do, how you do it. I mentioned that you are a concierge physician, how long you've been doing it, and then let's get into what you've been doing lately because of the coronavirus.
Sure. Thank you, Rod, for this opportunity. I appreciate it. So my name is Iman Bar, and I'm a physician that has worked in the community of Newport Beach and Corona Del Mar for over 20 years. So I do have different specialties. I have worked through the community as a GP, as a pediatrician, urgent care. And over the last 12 years, I've focused on concierge medicine in Newport Beach, where I live and have my practice for the last 20 years. And the highlight of my practice, really, when I chose concierge, was to provide more personalized care and actually providing the care where the people need it most. So I was available night times, weekends, and actually providing the service to get to a patient when they need me most at home versus in my office. So it was availability. Everybody had my cell phone, and everybody can reach me or my assistant at any time if they need it. So that was the highlight of it, because I know there was other practices years later that just got onto the concierge with a different concept. So I've been doing the concierge urgent care in my area recently, more focused on a very important issue that we have been all hit by, which is a viral epidemic or pandemic. At some point became a pandemic. And I started getting involved when it was an epidemic in China and getting into Europe. So that's when I started being concerned. And I had one of my patients, this is how it started, early March. She just came back from England and Africa, South Africa, and she flew through multiple airports, and she called me 10 o'clock at night asking for me to see her. She had a flu symptoms and high fever and was concerned. And I was aware that the epidemic of COVID-19 was hitting the world. However, we were thinking, oh, it's never gonna hit us that much. So I asked her, because it was very late, to go to the ER, because I didn't have testing at the time, assuming that the ER will be able to do that for her. However, Hope just tested her for the flu and sent her home. I usually follow on my patients next day. I did check on her, and she was getting worse. And turns out to be that she was a person infected with the virus. It was very difficult to get testing at the time. I tried to the local big corporate labs. They wouldn't send you kits. It took forever. So I reached out to local and privately owned labs. And I was very lucky, because I've been testing a heavily infectious season for the flu. So I had a lot of the PCR kits that would work for the viral panel. And we were testing mostly for the flu at the time. And that was the confusing part, because we had a lot of patients that had the flu at that time with similar symptoms. Right. However, she tested negative at the ER, and I was able to get some kits. However, it took me about maybe 4 or 5 days to get her confirmation. And that's where I decided I'm gonna take this in my hand. I'm gonna work on finding the labs that would support me. And I'm gonna do this, because apparently when I discussed it with the local hospitals, they were not doing the testing. CDC had very strict guidelines. And I was getting calls for the urgent care for a lot of people suffering from the same thing, the cold, the flu, the fever. At this point, I was able to confirm a couple of labs that through their private owners, small boutique labs like my practice, that were able to promise me 24, sometimes 48 hours turnaround for the results if it's the weekend. We've been working 7 days. The 2 labs have been great. I appreciate their efforts. So we started doing drive-bys, because everybody was concerned. Why are we not having the testing done? Every nation, even like maybe less advanced than we were, like even China, they were testing everybody. Korea has controlled the whole thing through that availability of testing for everybody, because then you can contain the epidemic that way.
Right.
So anyway, the short of the long story is I was able to get a couple of really good labs that were reliable, because I went through 2 other labs that we still have to wait over the 72 hours and backlog. The second lab that I'm working with, Vitae, they were able also to get approved the antibody test, which is a blood draw. It's not anything of the fingerprint prick that everybody's still confused about, and FDA sending all these warnings for fraud. We'll send you a kit home and you test yourself, but nobody knows the reliability of these kits too.
Well,
and there's a lot of questions.
Dr. Bar, I'm sorry, I'm interrupting,
Yeah.
but there's also been a little bit of concern. I mean, I've heard it from people that are in my family that are, that are involved either at the government level or even, physicians, retired or practicing, and they were saying that given the sense of urgency for people to know right now, there's also a lot of scams out there or fraud that's happening relevant to this, because basically everybody wants to get the clearance papers, say I'm good, I'm fine, especially as we want to get back to work, as the economy, economically people get hurt even more. This is not an endless situation where people's tolerances are going to last longer than another, let's say 30 days or whatever. I'm already seeing it, in my capacity in terms of both construction and in terms of the podcast. We are quote unquote considered essential services. So I've been getting around a little bit out there, and I will tell you that I have noticed an increase in traffic on the roads in last week compared to the first week. And I think it's a barometer reflection of people's tolerances of basically putting up with the sequestering or not. And at some point, they're going to say, the cost to me on every level is higher than my risk factor. But with that being said, there are people that are out there that are sort of taking advantage of that in an immoral way or in a scam way. So what do you say to people that are saying that? How should they proceed with this? If they want to do this, what should they be looking for? What things are basically things to avoid?
Okay, so I'm sure there's going to be more labs coming out with this test, and I think you need to research if this lab is accredited. This lab had to go through FDA regulations and approvals and validations. I got to tell you, really, because this is a new virus, this is a new disease, and we do not know a lot of things. And I'm compiling data. So far, I have hundreds of samples, and I'm adding both the PCR with the antibody. We do not know really what is the length of immunity, who is going to develop the immunity, and when. When. So there is a lot of uncertainties on unclear data. That's why the government maybe is not also rolling out a mass, testing for the antibodies. But antibody testing is not a novelty. It's not new. It is something that we use on all kinds of viruses that we see all the time in infectious disease. However, because of the behavior of this virus, we don't know if a person is infected, when are they exactly going to produce the antibodies, and for how long, and what type. So the virus is composed of different parts. There's the spike that everybody loved, that little beautiful corona. That is the very characteristic part of the molecule for that virus, and they're trying to create antibodies to it. However, other people would think maybe we should do it on other parts of the virus. So this is where the differences between kits and differences between the nation, even the PCR was different from one nation to the other. The Chinese, the one that they've used, that reported only 30% sensitivity for the PCR. So you would have a sick patient and they're in the hospital getting on a ventilator. However, they're still testing negative on PCR. That's why they did antibodies and they followed. So the key is sequential. I don't think one test is going to be enough for a person to say, oh, I'm negative now, or I'm positive now. Am I going to have it for later? So that's what its use was in China or in other places that have been dealing with this for more time than we did. So the antibodies are good if somebody has, for example, the IgG, and they're, for example, testing negative for the PCR, then they know they have immunity. How long is the immunity going to stay? We do not know. But I think that would be a good barometer for people to be able to say, I'm immune, I can go back to work, I'm not infectious. However, I think because this virus is going to be with us for a long time, antibodies are great if you get them through an accredited lab that you check. And then you still have to be cautious about wearing a mask, because the mask is not from you for you to get prevention. It's more from you for you getting the infection and circulating it back again.
So it's more protection for others.
Yes.
Than really protection for yourself.
Yes.
Okay, so I mentioned before I brought you on that I actually had asked if you would basically give me an antibody test, and we did that last week. Yeah. And to your point, the turnaround, even though I can't remember, I think we did it Friday, or was it Thursday?
We did it Friday evening, so right. I didn't have the chance because you're my friend, and we sent it to the lab on Saturday. However, it was Easter Sunday, so no, we got it on Saturday. Did I report it for you yesterday? Sorry.
No, today's Monday. So no, my point is, even though we did it on Friday night and you sent it in on Saturday, to your point that the turnaround and the fact that it was even Easter Sunday, granted, because we know each other, maybe the lab made, but there was a very quick turnaround. You called me. No,
actually, I have to interrupt you. That weekend, we tested over 70. We went to the firefighters and the police department. So the labs brought support staff. I don't have support staff. And we tested 70 samples, including yours and my another colleague of mine who's a nurse that I was concerned about her. So we had like about 70 samples ran over the Friday and Saturday. And I was able to report the results to you yesterday.
Yeah, I mean, you called me definitely on Sunday, on Easter Sunday, literally, and basically gave me the results. So let's just tell people, so you gave me the test. And when you called me, you said you don't have antibodies. So for people that are going to get that result back, if they do that, what does that mean?
Okay, well, let me tell you something. I mean, most of the people that are in the community are going to get a very mild illness. Very few people that are at risk are going to have a serious illness. So let's put things in perspective.
Right.
The flu kills more people every year. Granted that we did not isolate and we got it out of control. If we control this illness as it would have been expected to be done properly, the flu, for example, the infectivity of the flu in simple terms, if I have the flu, I would give it to one person. The coronavirus is very easy to spread between people. And if I have it, I would give it to about average 3 people, 2.9, which means one person gives it to 3, the 3 gives it to another 3. It's very exponential. It's very easy to be transmitted. The other problem with it, it's a long incubation period. And the very last part of the incubation period is very infectious. And also the first week of infection is very infectious, different than the flu. Right. So that is why it has spread out of proportion. That's why if you have a huge number of people infected, that's why the fatality is high. However, the mortality rate is not as high as a flu. So that is why we're in trouble. So I think once the numbers goes down, it's going to be good for everybody to get the test, to know what their immune status is, right, and to be able to go to work. And hopefully we'll have something called herd immunity. Right now, I'll tell you, I have maybe about 100 tests because this just started pretty recently. And I'm trying to compile more data through the lab itself because we're testing, that's what I'm planning on doing, a study, testing healthy people that are at high risk. So for healthcare providers, first responders, that's why I reached out to all the city managers and mayors. I would be happy to test them to give them peace of mind if they know they were exposed and non-immune and safe in the community. Especially they also qualify to get the nasal and PCR test. Yeah. So that is one factor. But out of all this data, if I test 1,000 people and I find most people are not converting because they're healthy and strong and barely got an infection. So far, I'm getting everybody almost negative on their immunity part. So I myself tested negative on the PCR last week, and I've seen, I want to say, hundreds of people that were sick. However, I'm still negative on antibodies. I have not got sick, knock on wood, throughout the process. I didn't even have a fever or a cold or an ache, or some people complain fatigue.
Mm-hmm.
I haven't got it. But also I was thinking the herd immunity, where when you're exposed and exposed and exposed, maybe you'll start getting antibodies like herd immunity. We'll find out. We need to do more numbers. But so far, over 100 samples, and most of the working responders and nurses that I've tested and physicians, they're still coming negative so far.
What have you encountered in your testing that you've been doing that may have surprised you? Like, was there a particular case that surprised you? Is there anything that is out of the ordinary? I mean, I'm trying to understand why this particular, because when you talk about it rationally, when you talk about it in terms of what we normally would do in situations like this, when faced with something new, like every year we have a new strain of something that happens, so derivative of something that happens, right? We've never had this reaction. Now, I understand it's a global versus regional. I understand that there's that compounded this, but I'm still trying to understand, like, you are out there literally testing people. And you're testing people that are, in some cases, even first responders. So technically, they're the most potentially in danger of contracting if they don't already have it, because they're out there helping, on the front lines, if you will, right? So what have you encountered? Have you encountered anything in your testing so far that has surprised you, that have given you, a reason to be cautious? Anything like that you're at liberty to share?
Yes. So my surprise is like in the patient side, like the first responders and firefighters, even though some of them chose to do the PCR, everybody was negative. And some of them reported, I felt like I was sick last month. I thought I had a long flu than the usual. A nurse had dealt with one of the very sick people in her hospital. She didn't get the virus, and she didn't do any immunoglobulins against it. What's surprising me is the government is just saying there's one test that everybody should do, which is the PCR. And I've seen a lot of sick people. When I started this in the beginning of March, the first week sometime, it was for sick people. And I had people coming back from cruises, people coming out of the country. I got people traveling from different parts of the state and even in my community. And that's why I was alarmed and nobody was reporting this. So they would test negative on a PCR. They're sick and they look like COVID, right? However, I do the swab, and I know it's technique dependent. People have to tear. I understand that it is a very painful test. However, they would come negative and they look like COVID, so I would isolate them. Now, what I'm doing, sometimes if I had a really sick patient, they end up in the hospital, they go to the hospital. This is an 82-year-old lady. I tested her for the PCR, she's negative. She ended up in the hospital, she tested negative. Guess what? This week, when I tested for her immunoglobulins, she came positive for IgG. She's much better. All my patients, none of them really ended up in trouble, because I treated everybody with like antiviral and boosted their immune system. I give everybody IVs. However, this lady was negative twice, one by me and one by the hospital. And then her antibodies this week came positive. Same thing happened in multiple patients. And now I'm bringing a lot of the people that look like that they had COVID, I'm bringing them to see what's their virus status. So that will give us more information.
So that really gives me concern, because the way we go about testing, in a way, it's almost like the minimum requirement, whether it's because of insurance coverage, whether it's because of time the physician is allotted per patient, whatever it may be. The way the system is, it basically, what I'm thinking is, people are, especially if the government's pushing for one particular test, is people go in and they get the swab test and it comes out negative, and then it's like, okay, thank you very much. But in fact, that may not be sufficient testing to basically really clear them. Yes?
Exactly. It's a concern, because that person should be isolated regardless. So they shouldn't be given, here, you're negative, go home and hang out with everybody else, because probably they have COVID. And we know statistically in the area now, like maybe it's 60% picking up patients that are positive. So the remaining 40%, they will be negative. Of course, there's shortage, but do they need a second test again? It depends on the viral load, the amount. That's why a lot of patients, when they came to me, it's like, if you really don't have nasal discharge and you've been sick for a week, chances are you possibly are clearing it. Or if you're coughing, it's done. These are statistics and studies I'm talking about. It goes down to the lung if they're still coughing and having a pneumonia. However, it's not living in the nose anymore. So they test negative by the PCR because it depends on the viral load.
Right.
These are the people that maybe you need to do an antibody test to check them again. And if they're still congested, I would do a second PCR. However, we have a shortage. I don't think it's an issue of healthcare. The PCR is available and covered by insurance for only those who are at risk that the government decided should be tested. And that was their guidelines. A lot of other countries, more advanced than we were, like Germany, they tested everybody and isolated and got rid of the clusters, and that would be the best.
What is the current qualification as far as the government is concerned, as far as who should be tested or who's in that?
Sure. So that's on the CDC guidelines. So this is on the website of the CDC. Somebody who is sick. Okay, so there is an element that somebody has to be sick. And if they're 65 or older, they automatically get qualified for the PCR. If they're less than 65 and have underlying conditions, and these are the underlying conditions: 1, diabetes, hypertension, chronic lung, like asthmatics too, like bad asthmatics, I tested them, chronic heart disease, or immunodeficiency. If somebody is having like a rheumatologic disease and on steroids or immunosuppressants or had recent cancer. So that's the only people that would get it, but they have to be sick. I've got a lot of people wanting to get checked for anxiety. I can't get a positive test on that.
Well, but that's when you think about, granted, I don't think we're going to go back to the old normal. I mean, I think face masks and gloves is sort of an increased sense of hygiene and sort of sense of protection from elements, especially as we enter another full season. I mean, what prompted me to basically say yes when you said, would you want to do a test, is because I actually was diagnosed with influenza type 1A in January. And actually, when we were talking about the antibodies and how long they are in your system, that's also not a forever situation. That's why you're talking about possibly another test after a certain period of time, because it may come in okay one time, and then if you're feeling any of the symptoms, you should probably get tested again. So that just adds to the complication of how do we get back to some sort of normal, right? I mean, it's so where people are today, Dr. Bar, like where we're sitting today, 2 weeks, 3 weeks into this, depending on when the countdown started in your part of the country or part of the world, and people are shaking their heads going, what do I do? Okay, what do? I do not qualify. I'm under 65. I do not show any symptoms. I'm still concerned. Am I a danger to myself and others? Which I tell people, until I have my coffee in the morning, I'm a danger to myself and others. So I'm actually safe this morning. So, okay. But the thing about it is, what should people do? Do we just sit around and wait until we are basically told, now you may step up and get tested? Can we do anything other than, making your ginger drink and trying to get your immunity levels up and, work on some of these sort of home remedies that I basically do those under normal conditions, because that's just what I do as far as a regimen for wellness in winter. I do my neti pot. I do my eucalyptus spray in the shower every morning. I do a 1 inch of fresh ginger in hot water twice a day because of the respiratory, benefits of ginger. So there's things you can do. But other than that, and then just basically, pray that I'm going to be okay, is there anything that you recommend they should do today?
Yes. So we know that's a general rule. When our immune system is low or down, we get more infections. So we have to be very careful, especially that we have the pandemic going on right now, with the things that we do. First of all, we need to be positive and less anxious, because when the adrenal glands are stressed, you get more susceptibility to infection, which I've noticed most of the people are very anxious. This is actually, if anything, is a good time for people to count their blessings, be with their families, realize that there are so many things that they can do on downtime that they haven't been able to do. I understand everybody is stressed financially, but we're all in this together. So if we just focus on being positive and, you know, kind of boost our immune system by the healthy food, by having the vitamins. I've posted on my YouTube, it's under my name, Iman Bar, a lot of the things that actually are antiviral, and they're been tested even for the SARS and the MERS, the similar things, and the coronas from previous epidemics that we had, like the swine flu, and also the similar ones from corona. So basically, zinc, vitamin D, vitamin C, selenium. That's why a lot of the infections are coming from this areas, endemic and selenium deficiency. They have mutated viruses and they end up causing problems. And we don't have an immunity to it, but we need to have our innate immune system, the natural defense that we have, get a chance to actually fight it and give us some immunity to it. And then after that, I think testing will eventually be in place. I think the government is cautious who and how they will roll out the antibodies, because there's a lot of issues with sensitivity. So it's going to be the same idea like the PCR. However, now everybody that's not even sick thinks they're fine because, you know, we don't know how sensitive it is either or not. So it's just going to be a matter of time. This is not only the United States. The WHO also have guidelines for the antibody testing, and they have mentioned and acknowledged the PCR being something that's not the best way to test. However, this is a new disease. Maybe next roundabout, we will be much better able to identify it with better probes or tests, kits that will be more specific than what we have. But remember, this happened very fast. And I guess we still have questions. I think it will improve, but antibody definitely has to be a test, because we've used this for all kinds of viruses. It's not the novel coronavirus needs to get an unusual test that nobody have used. But I think they're cautious about making sure that it is sensitive enough and available for millions of people. Because if you think about it, there's a shortage in the world, suppliers shortage, even for the PCR. So that is a problem. The government is trying to get supplies from different places, like that have the probes or the PCR kits and stuff like that. There's so many elements that get into the testing.
Well, and the testing and the lab facilities and all that stuff that you're talking about, that's again why you know, I caution people to do their homework, because
yes,
as is the case, anytime something like this happens and you have a vulnerable population and a stressed out population, it is sort of fertile ground for scams, for things that are not on the up and up. So definitely reach out to people that are somewhat familiar with this, or not somewhat familiar, very familiar with this, I would say, and really can guide you. They are out there.
Yeah, I don't mean to interrupt you, but I prefer that these tests needs to be done through a provider, because there's an element. I mean, I have to put an order to those 2 tests in the labs and then get the results. I have history, I have examination, I have records on the patient, and I put the pieces together. And then follow up is very important, because as we said, we don't know what is the future of a person who's going to be developing antibodies, how long is it going to last. So this is the most important thing. People should do this through their healthcare providers, somebody legitimate. There's a lot of things that came online, buy the kit and all that kind of stuff. I got offers to buy masks. I got real estate person telling me, I have 10,000 masks, can you help me move them? It's like, what are you doing with those? Like, leave them for providers. Why did you buy them? Because hospitals they don't have enough supplies.
Yeah, there's definitely like you know, what do they call them? Not opportunists, but
opportunistic people.
And profiteers. And definitely that is going on, and hoarding of supplies of this nature, which is really, in my book, just unconscionable in this time like this. I want to just touch a bit, because you mentioned to me also, and this kind of goes back to sort of the idea of stress and anxiety, and understandably so, that this is a stressful situation. But Before I ask the question, it is important to not put yourself or try to minimize and put your mindset in a place where you minimize the stress and anxiety, or you find healthy ways to deal with it right now, because that is also
Yeah.
going to lower your immunity. That's also going to physically have an impact on you, right?
Yeah.
I mean, they say stress is a killer. It's not a joke. It truly is. Anxiety now is added. You got additional pressure of, now you're dealing with your kids 24/7 in the same household. There's not enough alcohol in the household to let you, don't dull that pain or self-medicate, right? So, I mean, we're joking, but it's true. I mean, I hear the stories every day now. But
Yeah.
you said
It's true
something to
life.
me, which was about gut health. And
Yes.
that's also important as well, right? Can you take a minute and talk about that? Because again, I'm pouring a lot of alcohol in my system. I'm not eating right. I'm stressed. I'm snacking. I'm hoarding everything that I normally would not buy because
Not
it's somehow,
exercising because you can't. Yes.
yeah.
Yeah.
So let's talk about gut health for a minute.
So health is very important in this situation, and especially that we actually know that this virus can invade through the gut. And that's another thing. People might be actually contagious later because some people had diarrhea and maybe no diarrhea, but they will be actually excreting the viruses in their gut. So it's very important to, in my opinion, to keep your gut healthy. So probiotics, eating healthy, a lot of vegetables, a lot of greens would be great because they have the micronutrients and they have the probiotics and prebiotics in them. So more vegetables than the usual. And then the most important thing too is just to make sure that with any symptoms of diarrhea or gut issues, that person needs to be isolated as well, and worry possibility of excreting the virus and spreading it. And that's why they were saying if somebody's sick, do not share the bathroom, and make sure it's sanitized. So that's why most of the bathrooms are closed everywhere. And people don't think about it.
Well, right,
But
because I mean that's not in the realm
yeah,
of the whole conversation that's taking place right now. That hasn't happened. I'm only bringing it up because it really ties into sort of the overall awareness of wellness and regiment of health, and that if you're not already in that space, you may be unfamiliar with it. If you are in that space and you're using this as an excuse to basically do everything that you normally wouldn't do, it's like because there's coronavirus. I can eat whatever. I couldn't get the healthy vegetables. So I went for the frozen food section and everything that's not healthy. Let me tell you, I have not gone into a grocery store in the last 2 weeks and found any issues with finding fresh vegetables. There
yeah,
are,
I have an episode on YouTube. I don't think I posted it yet, but I had it like a couple of weeks ago. And I just got those pots online, and it's springtime. And I was telling people you should have your little fresh vegetables in the balcony. I don't have a yard. So I have a little nice sunny balcony. And I think I should post that episode because I think it's important. This week we should be less out in the supermarket. So let me tell you something. I was very disturbed today. One of the people called me and they said, "Oh, do we have it in Orange County?" I said, "Yes. Easter Sunday was the highest
do we
mortality."
have coronavirus in Orange County?
Yes. And I said, "I'm sorry to tell you that, but Easter Sunday was the highest mortality, the highest cases of death in Orange County." And then there is conflicting news whether this Wednesday they're going to be the peak, or some kind of scientists and people in health are saying it's going to be in May, the peak, the curve.
Well, let me just say, relevant to the thing about grocery stores. Yes, I mean you shouldn't go out unless you need to, and obviously if you go out, you should be making sure that you have protections as much as possible. Again, the mask situation is not so much for yourself, although of course it helps, but also any layer of filtration. But and it's also for the other people around you, just to try to control it. But grocery stores now, it's funny because within 2 weeks, this is the thing that's very fascinating about this for me, is how quickly we have actually connected with what to do. So we have actually found ourselves adjusting to this so quickly that we basically have now grocery stores that have decals on the checkout lanes to basically allow for the 6-foot spacing between people and so forth. But again, be smart about what you're buying, be smart about what you're doing on a daily basis, because right now it may seem like all the rules and normalcies are out the window. They're really not.
Sorry, Rad. I missed you for a minute. I missed you because the internet was
Well,
unstable.
it's okay. I know it froze a little bit on my end, Dr. Barr. But
Okay.
what I was saying is just, you know, it's fascinating how quickly we adjust to things as human beings. There's grocery stores now that have decals that are like branded decals on the floor with the 6-foot separations and all that stuff, and one side in, on the other side out, and the line is outside. So everything around us is adjusting. If anybody's thinking we're going back to the old normal, think again. We're going back to a new normal, and some of these
Yeah.
things are going to be with us, which is not necessarily negative. I mean, you know, you and I basically grew up in parts of the world where we basically never brought vegetables and fruits into the house and didn't wash them. So for
Mhm.
somebody to say, well, oh my God, I have to wash my vegetables and fruits, I'm like, yes, welcome to the rest of the planet, right? You know, I have to maintain my gut health. I have to basically maybe think, what am I doing? And, you know, that's more maybe holistic or, you know, natural, you know, treatments or something that is not necessarily big pharma related during the course of my winter, because I'm more likely to be exposed. My immunity may be done. Be aware of the fact that if you're stressed, you basically are a little bit more risk than if you're not stressed. So
Yeah.
these are things that are not necessarily negatives if we become more used to them as a whole, as a society.
Mhm.
That being said, again, I want to just make sure that people know how to get hold of you. So if you wouldn't mind, let's share the website with people. What website can they get hold of you, or how can they get hold of you, Dr. Barr?
So I have Newport Concierge Medical. It's a mouthful. Newport Concierge
Newport
Medical.com.
Concierge Medical. Yeah.
But I also have it pointed to housecalls.doctor. So it's a lot of house calls, but one doctor.
Yeah. And she brings her own medical bag. There it is. You see, you can see it behind me. So, you know, and also we decided to do this today because I believe you are going to actually have some media coverage, at least local media coverage tonight.
Yes, please spread the word. So tonight, I'm going to be on national TV. Last week, I was on California TV, Channel 7, and this tonight, because I was involved in promoting the antibody testing and communicating with the producers on some, you know, scientific information that probably would be beneficial, and getting the word out that antibody testing should be hopefully rolled out soon. And, you know, tonight I will be on a Nightline ABC. I don't have a TV, sorry. I have to download an app. So
Well, we'll
Nightline
find
ABC.
it.
I
I
was on
believe.
it before. Yeah.
I think that's what you told me. I thought you told me Nightline ABC, but we will make sure to post that as well on when we post this for people. Um, Dr. Barr, thank you. I know you're very busy. I know you're running
Thank you.
around
Thank you.
and
But
doing.
one most important thing, if you're going to send this to all your, you know, fans out there, I know you have like a great, you know, show going. Please ask people to keep their distance. It's huge. It's a teeny, teeny virus. And if everybody is out there thinking they're jogging or walking, if they are walking in the same path where that droplet is, they're going to breathe it. So a mask can help the protection a little bit. And it has to be a mask that's washed. It cannot be the same, you know, mask that they've had, whether it was the N100 or P95. They should not be wearing it on and on. They're increasing the risk. So when they're out, please wear, even if they're disposable masks, because that droplet is in the air and the virus is very tiny. It hangs out in the air for hours. So even if they say, oh, I'm walking in a place where there's nobody, somebody was there an hour earlier and sneezed or coughed. So
So
please,
let
that's
me ask you
something.
something since you brought it up. So what do you think about all these like masks that are being made right now? I mean, obviously different fabrics. There was a report from Forbes, one of the ladies I actually interviewed, who's doing a lot of this volunteer stuff, and they actually just, I think, filled an order for the USS Teddy Roosevelt actually even last weekend. Uh, and so what do you think about that? I mean, for those people that are looking to buy something, they can't find the other ones. I agree with you completely. There's a misunderstanding that the disposable ones, the N95s, those are ones that you can use over and over and over. You can't. So
This is what
with the fabric ones that are washable, there's some that maybe even have the ability to put a filter in the pocket or something of that nature, double lined or triple lined. I've seen them both ways. What do you think about that? Is that a good investment for people to have maybe a couple of those to keep around, you know, to be able to wash them and put them through those cycles so they always have a fresh, clean one?
I think this is going to be with us for quite a bit of time. Our culture has to change. We will be wearing masks more often coming up probably in the near future.
Hmm.
That's not going to go away. And maybe next year or whenever we have a season like that. So if you have a homemade mask or the P95
Yeah.
or the one N100, the surgical masks, even the P95s, they do not protect from the virus. I told you the virus is 0.1 microns and less.
Yeah.
These only filter up till 0.3. So even the physicians and the nurses, first responders, they need those masks because they're very close to a patient. That's why we also wear a shield and we can't find them. The problem is the virus will go through them again. And unfortunately, people are reusing them. So the virus is sitting there and there's a way of sanitizing them, but that's not the best way. I think people should have masks made at home or somebody professionally making the mask. If they want to put the filter, is fine. And it's not by any means thinking if they have the mask, they're 100% protection, they need to keep the distance. That is the key. Keep the distance and put on a mask. The mask can protect you probably a little bit, not 100%, but also.
Well, anything is better than nothing, right? At this point, I mean, anything is.
Absolutely, absolutely. But I'm not saying like put a mask and you're going to be 100. Even the N100s and P95s are not. It's on the FDA website. It says you might even die. It says that the risk of protection and you might even die. So I think it's important to people to get the washable ones. That is huge because you can have 4 or 5, you wash them, the virus dies from hot water in the cycle. I think these are safer. Actually, I would wear my, N100 or P95, and then I can have another one on top because you know what, these could be cleaned off.
Yeah, no, I agree with you. I mean, I think again, it's not 100%. There was a report by Forbes, I think, after the last, it might have been either SARS or I don't think it was H1N1, but there was a report about what different materials had in terms of filtration. To your point, it's a very minuscule sized virus. Anything is better than nothing. Don't be walking around there stupid. And I think you're right. I think this is going to be with us for a long time. I even predicted, I think my first interview when I started doing these on a daily basis, I said to whoever I was talking to, I said, I bet you these, if they don't make it to the fashion runway by the fall season, they will be in the spring collection, right?
I saw the cutest one, the eggs for Easter, they had masks. Did you see that one?
Yeah. I mean, I'm already seeing people, and I think it's a little grotesque and really kind of lacking of empathy and compassion, but I've seen people, selling like Louis Vuitton and Fendi and Hermes masks, and I'm thinking that's totally obnoxious right now. But with that being said, yes, I think it's already crossing the line, right? I think again, like everything else, there's a lot of potential scams out there. You want to do your research, find out what you're buying, who you're buying it from, how is it put together. But I think anything is better than nothing. And so in certain societies in the world, masks would be, I mean, talk about the Japanese or people that have, live in environments, Chinese that live in environments that have high smog content or carbon dioxide. It's been a standard. And I think if you buy a few of them, and I agree with you 100%. I mean, I have one that is washable. I'm already at a point where I need more than one because I can't just, it's like my reusable grocery bags or things that I have to wear. Like I can't just have one because I can't wash it every day. And I'm not going to run the washing machine on something this small. So you should have a few and basically put them through circulation, and at least it will give you some level of protection. And if it happens to be something that you can put another filter in there, now you got 2 layers of fabric and 1 layer of filter, so it increases it. And I'm sure over time the filtration will become available where it's a little bit more, like it's almost like air conditioning. Like eventually they came up with better filters to capture more particles. So somebody is going to come up with a filter that will fit into the mask that will provide you with additional that, right?
Yeah, the more the layers, the better. And if you go out more than once, go to the supermarket and then you have to go to the gas station, change the mask and wash it. That's my advice.
Well,
and the mask.
I appreciate it, Dr. Bar. I really do. I mean, I think we've covered a lot. Again, let's give out your website for people as we end here. What's the website again?
Housecalls.doctor.
House call doctor. House call God doctor, right?
No, house calls.
I actually, you know what? I have the card here. It's I know it's not what the original one was.
Okay.
So let me
But
give
you
it
know,
a house
people,
calls plural period doctor. So house
yes,
calls period doctor. That's Dr. Iman Bar. Thank you so much, Dr. Bar, and
thank you,
keep
Rod.
doing what you're doing. I appreciate it
Thank
very much. And again, don't miss out on Dr. Bar. She's going to be on the air tonight on national TV. We believe it's Nightline on ABC, but we'll check
you.
and we'll basically add that to the text when we post this. Thank you, Dr.
Thank
Bar.
you.
Thank you for
Thank you.
taking the time to give me the test too. Thank you.
Of
Bye-bye.
course. Thank you. Thank you. Stay
Bye-bye.
healthy. Bye.